good evening everybody, and it is really a pleasure to be here with you in Enniskillen for this very important conversation. Thank you to Philip for the warm introduction, entirely unwarranted, I may tell you, to our fine panellists and to the Commission on the Future of Ireland, and of course to my friend and great colleague Pat Cullen MP. Thank you all, most importantly, for being here, community workers, health staff, carers, families, local campaigners, because your voice matters hugely. Tonight's discussion comes at a time when health and care services in rural Fermanagh and across the border region are under enormous pressure. And people here know better than most what it means when services are withdrawn. You know that the removal of emergency general surgery from the Southwest Acute Hospital, what that has meant for ordinary families. You know the fear of the long ambulance journey to Altnagelvin on bad roads when every minute counts. So I want to firstly acknowledge the anxiety, the frustration, and yes, the anger that so many people feel. And I also want to recognise the tremendous work of community organisations and the Save Our Acute Services campaign, including our friend Father Brian Darcy and many others, some of whom join us tonight, who have mobilised local voices and demanded dignity and fairness for rural communities. Sinn Féin has been very clear. Services cannot simply be collapsed. Change has to be managed, safe and planned, with community involved every step of the way. And that's what this event is about, working with people to design comprehensive, sustainable health and care services and ensuring that rural communities are never ever treated as an afterthought. Because the truth is this: on this small island, we have two health systems, and both face deep structural challenges. In the south, we have a two-tier system where money can buy quicker access and quicker treatment. Sláinte care offered a path towards universal care, but progress has been far too slow and waiting lists remain unacceptably long. Here in the north, underfunding, staff shortages and years of Tory austerity have left services stretched to breaking point. Waiting lists are amongst the worst anywhere. Recruitment is an uphill battle. Decisions are too often made with one eye on what Westminster will or will not fund. And across the island, we see the same pattern. Working class communities, especially in rural and border areas, experiencing poorer health, shorter life expectancy, higher levels of mental ill health, addiction and suicide. These health inequalities are not inevitable. They are the result of political choices. And what makes even less sense is that on an island of just over 7 million people, we run two entirely separate health systems trying to solve the same problems and meet the same needs. People cross the border every day for work, for school, for childcare, and yet partition still shapes our access to care. We also know this, that when we work together, it works. The All-Ireland Congenital Heart Disease Network, Philip mentioned it, is one of the clearest examples. For years, Belfast simply didn't have the patient numbers for a safe, sustainable paediatric cardiac surgery service. So families were being sent to Britain. Clinicians, north and south, including Professor Frank Casey, who I want to acknowledge, and Professor Paul Ozliz-Zolak, and I really apologise for cannibalising your name. They came together, they set politics aside and said, let's build one high quality all-island service. And today surgery is centralised in Dublin. Belfast provides specialist cardiology. Outreach and satellite centres operate right across the island, and outcomes for children are now world class. This is an all-Ireland success story, and it saved a service that otherwise would have collapsed in both jurisdictions. The Northwest Cancer Centre in Derry is another example. Because of cross-border collaboration, patients in Donegal can access radiotherapy in Altnagelvin, closer to home, faster, and with less strain on families. And of course, during COVID, the All-Ireland Institute of Public Health helped to coordinate responses and information sharing in real time. So the idea of working together, it's not abstract ideas. These are proven successful models, and they point to what is possible if we approach healthcare at the scale of our island, not at the scale of partition. All of you know that the Good Friday Agreement provides for referendums on Irish unity. And I believe that these referendums will happen by the end of this decade. That means the choice ahead of us is not if constitutional change happens, if referendums happen, but whether we prepare for it properly or just drift towards it unprepared. Planning for the referendums and for unity has to happen now. And this is a core responsibility of the Irish government. It's also a responsibility that rests with the British government. In recent weeks, the British Secretary of State claimed, and we quote him, uses words, that there was no appetite for constitutional change. But that claim simply ignores reality. It ignores the depth and the breadth of public engagement that is now happening right across society. It ignores rooms like this one. And it ignores the lived experience of people who already cooperate across the border every single day. It ignores also the experiences of real people in their everyday lives, of the cost of that border. Change is coming, and the responsible course of action is to plan for it, to prepare for it, and to shape it together, openly, inclusively, and honestly. And in that future, in a new and united Ireland, young people, I believe, have to be at the centre. That's not to discount the rest of us, but our young people have to be at the centre. Rural health, rural services, and rural opportunity are not just about caring for today's population. They are also about whether or not young people can build their lives here at home. Young people in Fermanagh, in Tyrone, in Donegal, in Leitrim, in Monaghan, in rural Ireland, right across the island, should not feel that they have to leave in order to thrive. Everyone deserves, rural communities deserve, access to first-class healthcare, secure, well-paid work, education and training pathways, and the confidence that their future can be built where they belong. So a united Ireland must be an Ireland where rural youth are not exported, where communities are sustained, where caring professions are valued, and where public services are strong enough to support a decent life. That is why the work of Sinn Féin's Commission on the Future of Ireland matters so much. Since 2022, the Commission has created space for honest, inclusive dialogue, gathering hopes, concerns, ideas from every community and every tradition. And the conversation is now growing, not just within republicanism, but right across society. Ireland's future, the SDLP's work, the Shared Island Initiative of the Irish Government, the All-Party Oireachtas Committee on the Good Friday Agreement. People want to talk about the future, about what a united Ireland could look like. And healthcare is one of the first places, naturally, that they go. Because people understand instinctively that cooperation in health just makes sense. Sinn Féin believes the Irish Government should convene a citizens' assembly on the future of the island, with health and social care as a key theme. We believe that the Northern Executive and the government must deepen cross-border planning and put in place a permanent all-island public health framework. And most importantly, we believe the people, patients, families, rural communities must be the architects of that change. So I'm here tonight not only to speak, I'm here much more importantly to listen, and I'll be in the room with you for the vast majority, I hope, of this exchange. But be clear, this is your conversation, because it's your lived experience. It has to be your vision of what a united Ireland should and must deliver for you, for your family and for your community. So let's use this moment to design a health and care service that is, as my friend Philip has said, public and universal, planned on an all-island basis, rooted in community, especially rural communities, safe, sustainable and world-class. A service where every child, every older person, every family, north and south, east and west, is equally valued. A new united Ireland is being shaped, my friends, so let's ensure that healthcare and care is at its heart. So Shinn Mamage, Guru Mila Mila Mahugur.